Wake County begins administering monkeypox vaccine intradermally. So I just read that today and I was so excited, like, okay, we're starting to vaccinate. Interesting. But hold on, it's not that simple. And I know you've got a lot of questions if you're a parent like me. I've had a lot of questions come my way about vaccination for this monkeypox. Are we going to vaccinate our kids? Our kids are going back to, kindergarten or middle school or high school. You're like me, my kids just went back to college. And I was definitely thinking about the monkeypox vaccine, or the monkeypox infection. How do I protect them? Is this vaccine going to be available to everyone? When will it be available? What can we do as parents now, especially since it is growing here in the US? And again, it's back to school. So what are we as parents or as educators supposed to do? So I'm hoping this video, you will find it interesting, but also informative. So if you're new here, my name is Habiba Tunau, and I am a medical doctor, licensed US trained medical doctor. And I just wanted to clarify that because I am not a pediatrician, although we will be talking about your children and vaccines. I am not a pediatrician and I am not an infectious disease specialist. So all of the information that I'll share with you today is based on factual information that is up to date as of August 2022. As you know, when it comes to medical information and with the pandemic and with all these infectious diseases that are out there, things tend to change. But everything that I'm presenting to you today, information that you can fact check, you can also look up for yourself on the CDC's website or the WHO's website or the Environmental Protection Agency. I'm also referencing some current medical literature. So yeah, just want to put that out there for anyone that is concerned or would like to know. So again, I'm making this video with parents in mind. Anyone should be able to watch this video and get something out of it. But in particular, my target audience is parents. Because again, it's back to school and a lot of us have monkeypox and all these other infections on our mind, but I'm gonna focus on monkeypox right now and the monkeypox vaccine. Okay, so a quick recap on monkeypox. I'm sure you have heard it is a rare viral infection, so it's not a bacterial infection, it is a viral infection. And usually the symptoms tend to be flu-like symptoms, along with swollen lymph nodes. You'll hear people talk about they're getting lumps around their neck or in different parts under their armpit or in their groin area. Those are lymph nodes that are inflamed and swollen. You can also get rashes, fluid-filled, and then later they tend to crust over. And then how do you get monkeypox? Again, I'm sure you've heard all of this before, but a quick recap. You can get it from direct contact, skin-to-skin contact, direct contact with someone's face who has monkeypox. You can get it through respiratory droplets. If someone is close enough to you and they cough or they sneeze, you can get monkeypox if they are infected. You can get monkeypox from direct contact to lesions if they have any of those rashes or if they have any crusted lesions. You can get monkeypox from that. You can get monkeypox from sexual activity, whether it is just touching the genitalia of someone who is infected or, of course, having sexual intercourse with someone who has monkeypox. You can get monkeypox also from touching clothing that belongs to someone who has monkeypox. So their clothing or even bed sheets, towels, basically any contact with objects, personal objects owned by someone who has monkeypox can also give you the infection. So obviously we all have to be very, very careful. And as you know, children are one to touch everything. And also those of us that have teenagers or young adults, we need to be having discussions with them about, ways to protect them from monkeypox, especially as they go back to school. Just to be thorough, I just want to make sure I mention that, of course, kissing, snuggling, and all of that can also result in monkeypox. And if I didn't mention, monkeypox is not considered an STD, although majority of the cases have been contacted through some sort of sexual activity. It is not an STD because, as I mentioned earlier, you can get it without having sex, right? You can get it through just direct skin-to-skin contact or all the other avenues like respiratory droplets. So that is why it is not considered strictly an STD. So as you may already know, there's no cure for monkeypox, and it's an incredibly painful disease for those who have the lesions, right? There is a vaccine available. In fact, there are 2 types of vaccines available, and I'll mention that later. But the vaccines are really to help protect you from getting monkeypox. So a vaccine is great before you have monkeypox to help protect you against monkeypox. And I just needed to clarify that for some people. It's not a cure for monkeypox. If you already have monkeypox, you can get the vaccine, assuming that you get the vaccine, you know, within 4 days of the infection, ideally. But they also say between 4 and 14 days of the infection, you can get the vaccine because it helps lessen the symptoms. So it's just going to make, you know, the progress of the disease a lot more manageable, if you will, and maybe less painful, but it is not a cure. So as you know, since June, there have been greater than 10,000 confirmed monkeypox cases in the US, and it's been declared a public health emergency. And the CDC has raised the alert level in the US. I have some notes here because I want to make sure that I'm giving you factual information. So based on the rate, the bottom line is they don't have enough vaccines, right? They don't have enough vaccines. The current vaccine supply will not meet the current demand. That's basically the dilemma that the government is going through. So the goal has been to increase the number of vaccines. That appears to be the priority, right? And currently there are 2 main vaccines available. The first one is the live non-replicating vaccine. That is the JYNNEDS. Now the problem with that vaccine is it's not enough. And apparently the US government had about 20 million doses stored in the national stockpile, but they expired. So there was some sort of glitch apparently where this vaccine, this non-replicating vaccine, live non-replicating vaccine, you know, their initial stores or stockpile expired. So that's why they really don't have enough. And this information is available if you check out the monkeypox outbreak expert panel in Johns Hopkins back in earlier this month, actually August. Then the second vaccine that is available is a live replicating smallpox vaccine. So the first one I mentioned is a live non-replicating vaccine, but the second one is a live replicating smallpox vaccine called ACAM or ACAM 2000. The problem with that vaccine is that it is not for immunocompromised patients, whether it's people that, you know, are on high dose steroids for whatever reason, people that might be on dialysis, people that are cancer patients on chemo, even people that may not necessarily be immunocompromised but have skin conditions like eczema, apparently are not ideal candidates for this you know, live replicating vaccine. I'm just going to give you a quick timeline. Apparently in June, the US Department of Health and Human Services recommended the vaccine for those most at risk, right? And again, I think they're doing this because of the shortage of vaccines, right? And the people that were specifically listed to take the vaccine were members of the LGBTQ community and people living with HIV, okay? Those 2 communities were recommended as candidates for the vaccine. That was as of June. As of August, they've expanded that list. So then on August 9th, the FDA announced that they were going to permit fractional dosing. What does that mean? Fractional dosing means that the amount of dosing that they were approving would be a lot smaller. So back in the day, the smallpox vaccine was given IM, meaning intramuscularly. So the dose was a large amount that was injected into the muscle. Basically, it would go past the skin, past the fat, or past the muscle and fat, and that's how it was administered. But anyway, this fractional dosing means that they are cutting the amount that was previously given. Now they're getting 5 doses off of an original dose. So what used to be 1 dose is now 5 doses, split into 5 doses, because they're trying to spread out the amount of vaccine available. So here in North Carolina, and specifically in the Wake County area where we live, so the first documented case of monkeypox in this area specifically, you know, not in North Carolina as a whole, but in Wake County specifically, was back in July. And as of this month, August, there are about 20-something documented cases of monkeypox in this area alone. But in North Carolina as a whole, there are about 250 cases of documented monkeypox infection. So it's definitely a growing concern for everyone, and again, especially parents who have kids going back to school. So yeah, as I said before, the FDA has announced that they are offering the vaccine, and it will be given intradermally, which again means that it's going to be injected into the top layer of the skin versus intramuscularly, which was, you know, into the muscle, which is what was previously done in the past at higher doses. So as you're aware, the federal government, along with all the health departments, along with all these different agencies, have updated and expanded the types of people or the number of people that can get vaccinated, right? So that's the big question we all want to know right now. Who can get vaccinated? Parents want to know, can our children get vaccinated? So I'm just going to go ahead and read the list of people who can get vaccinated. And this was recently, again, updated. And this is specifically here in North Carolina from the health department, but I'm sure these guidelines apply to most states in the US. Definitely check your health department or check with your health department to see what they're saying specifically. If you have been in contact with someone diagnosed with monkeypox within the last 14 days, that's number 1. Number 2, if you've had sexual activity with someone diagnosed with monkeypox. Number 3, homosexuals or men who have sex with men or transgender individuals. Number 4, people who have multiple anonymous sexual partners. Number 5, people diagnosed with an STD. Number 6, anyone with a history of HIV pre-exposure or the PrEP prophylaxis. So basically anyone who has had to take PrEP, you know, for protection against HIV because they more than likely had unprotected sex. So what you see is that a lot of these groups would be considered people who have had high-risk sexual behavior. Okay, so also the vaccine is free, but people must register online, and they do provide a phone number, so you can check again with your health department. You can just look online. So as you can see, college kids, middle school kids, high school kids, kindergarten kids, or any kids going back to school in general were not listed this time. In my opinion, the reason that the vaccine is not going to be available for widespread use is the fact that there is a significant shortage in the vaccine, number 1. And number 2, also more than 98% of those infected with monkeypox are adult men who acquire the disease through intimate contact with men. Now, we don't want to stigmatize the gay population, and of course we know that monkeypox is not spread only amongst gay men, but at this particular time, again, majority of the cases have been seen between sexual activity, men having sex with men. So for the parents that are anxious about, their children or their teenagers going back to college, it might be comforting to know that there have been apparently less than a dozen pediatric cases of smallpox within the US. However, I do want to remain, pretty balanced and always vigilant. And I did hear of a case, or I did read of a case of an Illinois daycare worker who got infected. So certainly there is always a chance that kids in schools or kids in daycares could pick this up if one of the workers is infected. So, definitely parents, be on the lookout for where your children go to school. Yeah, it's definitely not impossible, but again, the numbers, amongst our children are very low. I also found a reassuring medical article from earlier this month that stated that if someone with monkeypox comes to a shared space like offices or schools, scientists have found that they do not leave behind enough live virus that can replicate and infect others. So I just want to clarify for the parents out there that as of August 2022, majority of adults and children will not be getting the monkeypox vaccination. And more than likely, it will not be necessary for them to get it unless they fall into those categories. But this is important. According to the FDA, as of August 9th, there is an emergency use authorization that now allows children under 18 to receive the vaccine if they have been exposed or at high risk for getting the monkeypox. Meaning that it's not impossible for a child to receive the monkeypox vaccine, although majority of us who have children will not be getting the monkeypox vaccine or will not be, eligible for it. However, again, there is exception to the rule. Okay, so now that you've heard all of that, what can you do? What are practical tips that you can do as a parent? What are things that you can do to help protect your child? I would say that number one, in terms of practical tips and things you can do, make sure your children are up to date with all their other vaccines. Because as you know, there are tons of preventable diseases out there that children still get or young people still get, such as measles, such as mumps, such as meningitis, especially in crowded spaces. You think of college dorms, young people do get meningitis, which is deadly. So make sure that they are up to date with their vaccines before they go back on campus. And for your younger children, make sure you have seen their family doctor or their pediatrician before they go back to school. The next thing is that make sure you are really stressing frequent hand washing, especially knowing that COVID is still out there. All these other communicable diseases are still out there, and especially with the kids going back to school, make sure you are again reminding them to frequently wash their hands. That has not changed. In fact, I think it's even more necessary. Wearing masks is another thing that you may or may not want to still do. So that is something I would make sure my children going back to college have masks, have, a lot of disinfectants. Also, I would make sure that they have, disposable gloves. That's something I didn't mention in the previous video that a number of you also mentioned. And yes, I think that is important. Another thing that I would do if I were a parent and I want to feel empowered is that, back in the day when your child or small child goes back to school, you would make sure that the teachers have apples or snacks or extra pencils or extra erasers. If it is at all possible, I would make sure that my child's teacher has some extra disinfecting supplies. So things like Clorox and Lysol are very important. These are strong disinfectants. I would make sure these are available. That's what I sent my kids back to college with. I made sure they had things like that, or the wipes that are antiviral and antibacterial. Make sure you're buying, legit products, because there are also a lot of products out there that are fake, that are bootleg. People are just trying to make money, so they're putting products out there that don't actually work. So make sure you're checking the labels. And another site that you can also check is the EPA, or Environmental Protection Agency. They actually have a list of specific disinfectants that work against all these different viruses. So you can go on there and you can check if the product that you are buying for yourself or for the school teachers or for your children, make sure that they're actually effective. So that's what I would do, right now, given the information that we have. So I hope this has been helpful, and I hope that you can share this with somebody else who's worried, or who's concerned, or who's not sure what to do, or who's not sure, about these vaccines and whether or not, their children need it, or why it's not available for their children. I'm going to be staying on top of this smallpox vaccine situation and in the infection rates in my area, and I definitely suggest that you do that too. If you are new here, don't forget to subscribe. This is usually a lifestyle channel, but every now and then, because of my medical background, I like to include pertinent, up-to-date medical information. So yeah, check me out, and let me show you this card I made. So let's see if this works. See that box in the middle? Go ahead and scan it, and that will bring you to all my social media sites. Go ahead and do that. Check it out. Let me know if it works, and go ahead and follow me on all my social media sites. Thank you for watching. Bye.